and gynecologist. Good morning, Dr. Walker. How are you?
Hi, morning. I'm fine, thanks. How are you?
I'm good. Thank you for joining us. I think to them at the top of the show that a lot of what we in the past have heard about menopause are mainly anecdotal. Women who feel it's okay to share, and not many women feel it's
Okay.
okay to share. Share some of the things that happen. But let's talk about menopause. What is it, and when does it happen?
Well, menopause on average will occur between the ages of 50 to 51 years. It's actually a diagnosis made in retrospect, meaning it's characterized by 12 months without a period.
Okay.
After that time, a woman is usually diagnosed as being in menopause, which is usually heralded by the onset of menopausal-like symptoms. So hot flashes, mood swings, night sweats, sleep disturbances. And of course, many women experience sexual dysfunction as a result of reduced vaginal lubrication.
Right.
Some women may also experience some body pain and tenderness, as well as mood disturbances, so the onset of psychological conditions like depression. All of these things usually are associated with varying degrees with menopause, and it can be quite debilitating and affect one's quality of life.
Yeah. And I'm glad you said varying degrees because when you speak to different women, you get different types of symptoms, different ways that they're affected. Um, but as I said, I guess we're gathering data. Is it predominantly hormonal? I know you've given the average age, but is it predominantly hormonal?
It's almost exclusively hormonal, so it's related to a reduction in the estrogen secretion by women's ovaries. And it's this sudden fluctuation in estrogen secretion which often affects these different organ systems in the body.
Right. Right.
The most consistent symptom, just as the hot flashes, sorry, usually occurs as a result in alterations in a part of the brain which regulates temperature. As a result, women will get these sensations feeling extremely warm or extremely hot, often affecting the head, the neck, the upper chest. And that is often accompanied by those night sweats or night chills which women experiences or which women will experience, and can lead to those associated sleep disturbances and insomnia. So everything is linked to the hormonal fluctuations which occur.
Yeah, I think one of the things when it's on the screen, it's interesting, is that most people, once they hear menopause, they shoot to infertility. Let's talk a little bit about ovarian insufficiency and what impact that has on fertility and menopause. What's premature ovarian insufficiency?
All right, so I'm excited that you said premature ovarian insufficiency because there's actually been a change in terms of a shift of terminology from things like early menopause or ovarian failure to more so ovarian insufficiency. Simply because insufficiency better characterizes what is actually going on. Whereas menopause will represent, the end of a woman's fertility potential, ovarian insufficiency is a little bit more fluctuant in that even women diagnosed with premature ovarian insufficiency can still move on to get pregnant in around 4% of cases.
Okay.
So what it really is a reduction in the ovarian estrogen production prior to the age of 40. So majority of women with premature ovarian insufficiency will have those same menopausal symptoms, the hot flashes, the mood swings, the vaginal dryness, the decrease in fertility. They will have those accompanying symptoms, which is why it was previously termed early menopause. However, it's not so cut and dry in that these women, even after or following the diagnosis of premature ovarian insufficiency, will still have spontaneous cycles where they ovulate and experience a period.
Right.
So it could be quite confusing if it's not explained to a patient that, listen, you may be diagnosed with premature ovarian insufficiency, and then you see them back 1 year later and they're pregnant, because it can happen in around 4% of cases. You have to understand that majority of these women are still within the reproductive years of their life, and therefore they may still have some functioning follicles, so the chance of pregnancy still exists. However, it's much less likely than a one without premature ovarian insufficiency.
Yeah, I'm glad we raised it because often, you talk to women and they'll say, I can't have children, but they don't go to the doctor to find out if this is the case, as we're
Correct.
discussing, and that there is a way to treat and to address it, or you hear some say, boy, they said I couldn't have a child, but no, I have it. And these are some of the
Yeah.
things, yeah, that they really need to get done. And that's something that can happen at any age group, because we've said menopause on average, which means it doesn't necessarily have to be that age group, but on average. But younger girls can experience a premature ovarian insufficiency, yes?
Absolutely. So it has such a wide age range in terms of the onset, from pre-pubertal, that is prior to entering puberty, to, as I mentioned, women into their late 30s. The truth is there are different causes. There are many different causes. Some are both congenital or genetic causes, and then there are those which are acquired. So you do have young girls who are born with genetic abnormalities, which predispose them to premature ovarian insufficiency, as well as young children who may be diagnosed with cancers or malignancies requiring either chemotherapy or radiation, which cause some degree of damage to the ovaries, thereby reducing the potential of these ovaries to produce estrogen. Those young women would therefore be diagnosed with premature ovarian insufficiency. The management, I would say, is much different in the very young group versus a woman who may be in her 30s who has completed her childbearing desires.
Yeah. They say so we don't say early menopause, but that's what's on its it anyway. So if you're experiencing that, because it's primarily hormonal, is there a way that you can slow it down? Is there a way that you can even pause early menopause?
But absolutely, there are ways, there are management options. And of course, we'll always have to deal with a wide range of the symptoms. It's really not just addressing one particular symptom which a patient has,
Right.
because there are both short-term as well as much longer-term implications for the diagnosis of premature ovarian insufficiency. Of course, the immediate term treatment is addressing some of those bothersome symptoms. So the hot flashes, the mood swings, all of those things could be addressed with the use of hormonal therapy. These hormonal therapy can take several different forms, ranging from the combined oral contraceptive pills that people are quite familiar with, Minigynon, Dan35, all of those different combined oral contraceptives can be used as viable options to replace those depleting levels of estrogen.
Yeah.
In terms of fertility, which of course the much younger patient would bear more importance to the much younger patient. As I mentioned, 4% of these women can still get pregnant naturally. However, by far the more efficacious option when it comes to fertility is in vitro fertilization. And often they would have to end up using donor eggs, so eggs from another woman who does not have premature ovarian insufficiency, essentially. In terms of reducing risk of things like heart disease, stroke, osteoporosis, all things which estrogen bear major importance in preventing. That is now where diet, exercise, improving the bone health, calcium, vitamin D supplementation, as well as the use of the hormonal therapy will help.
Yeah, and of course, because it's hormonal, there are other things that can affect it as well in terms of the thyroids, and so it's important that a woman goes in and gets herself the blood work done and everything done to determine where you are and what's happening. Would you say once you hit a certain age that it makes even more sense to step up the visits to the OBGYN and to ascertain things like that? Because as you say, it's hormonal. There are some things you can do to offset and things and so on, yeah?
Oh, absolutely. Women are much luckier than us men in that you guys have the protective effects of estrogen. So estrogen tends to help to protect women from things like heart disease, cerebrovascular disease, osteoporosis. But the truth is, once you enter menopause, that protective effect diminishes. And that is where we really have to start paying attention to the health in terms of diet, appropriate exercise, appropriate supplementation, and so on and so forth. And of course, the only way you're going to know where you are in terms of your heart health, brain health, is by visiting the doctor, getting those well woman checks, ensuring that everything is as it should.
All right. Doc, thank you so much for speaking with
No
us this
problem.
morning. I know that the Jamaica Midlife Health Society is going to be hosting a symposium on premature ovarian insufficiency and the impact on fertility and menopause on October 18th. So I'm encouraging our viewers to look out for that.
Absolutely. By the way, did I hear you're a Manchester United fan?
Is there
am I
another club
mistaken?
in the Is there another club in the Premier League?
I almost left this interview after hearing that.
But because you're a smart man, you stayed. I'll send it. So what team do you happen to support?
Chelsea.
Mr. the Blue. I saw the blue shirt and the blue in the background. My condolences to you.
Doctor, we're going fine till you say Chelsea. Arsenal.
I can't believe that. We had such a great, we were having such a great moment. But yeah. Alright, nice meeting you. Dr. Leo Walker, obstetrician and gynecologist. That's 10 minutes to your health. We'll do it again next Thursday.
Alright, you're not.